pharmacy point of view, the communications, health communication can be improved. Okay. So first of all, what is health communications? Okay, it includes the study and use of communication strategies to inform and influence individuals and community decisions that could enhance health. So the key point here is what are the strategies or method can be used, including counseling, either can be done virtually or sometimes called remotely or face-to-face. And very important, there's these terms, decisions. Later on, when we look at health literacies, we also involve what is the decisions in the health literacies. Then the patient have to make their own decisions on the particular health choice. Okay, ultimately, we like to see the outcome will be enhancing the overall health. It's very popular if you look at TikTok or social media. There is a lot of pharmacists having their own vlog or also their personal account. So this is one example. Dr. Sarah's looking at how she can influence the communities about health. So this is also one way of health communications. Like for example, there are several of the TikToks on health educations, looking at different diseases. So I'm not going to show you, I'm sure you are very aware. So it's good also, you can become the influencers to disseminate the correct informations through different happening social media sites. So why is so important to communicate well to the general public to influence their health decisions? Because overall, as you can see here, it can help to increase the health outcome and then reduce the emergency use of health services, which mainly the emergency department, because only if the medicines use is not appropriate could lead to adverse drug reactions, allergy, so that have to rush the patients to the A&E, accidents and emergency department. So it's also very important, it can help to increase the patient adherence. I'm sure you are aware, medication adherence across the board, about 50% of the patients are not taking their, or not adhere to their medications. That means they are not taking their medication correctly, either taking less or taking more or not taking. So 50% is a huge amount, it's a huge number, meaning to say that half of the medication you're dispensed will not be taken. So it's in terms of a sustainable development goal, this is not right, because it causes wastage and also it can pollute the environment. So there was a previous studies or systematic review done by Dr. Andy looking at the influence of community health education done at the community pharmacy level. So there's a lot more as a pharmacist that we can do, okay, to influence or to improve the health outcome through positive health communications. So just now I was talking, 50% of the patients are not taking their medications. But when we communicate with the patients, about 80% of the patients forget what the doctor say as soon as they leave the doctor office, because a study have done that. They ask the patient to describe what the doctor mentions or what was the advice. They tend to either cannot recall or they recall the wrong thing. Basically, that is the issue of health literacy. They cannot absorb what the prescriber says correctly. This includes also pharmacists. When you tell them the instructions, I'll play a video later, then you can learn this together. Okay, that's why it's always important during your communications or dispensing, you use the prime questions. What did the doctor tell you this medication for? What did the doctor how to use these medications, or also ask what did the doctor tell you these medications, what to expect from these medications. Okay, so in this way we can overcome this problem by knowing if the doctor say anything to the patient, or it doesn't look so bad on the patient if they don't know about their medications. So I just want to test this as well. I'm not sure whether I can, hang on. Yeah, because attendees, there are 300s. So let me just ask from the randomly. Okay, Ahmad Farhan, can you unmute yourself? Can you try to recall back what we have gone through the last 5 minutes? Or anyone which can unmute themselves easily. So
I'm
think
sorry.
about, yeah,
This
I'll
is
just
web. This is web. Participant can.
cannot. Okay,
Yes.
no worry, it's fine. Thanks. So okay. Now, so you try to recall back what did the main gist of or information that you can think of. What if you really can see, I'm sure some of you might just wake up, or some of you are not even switch on the sounds, which we will not normally know. So this is the drawback of having a webinar. If it's face-to-face in class, then I, as a presenter, I will be able to prompt or will be able to pose question directly to you. Okay, so always remember, use the layman term. Okay, so later there are a few tips that we'll go through together to improve the communications with the patients. So always think that patients have the issue in understanding what you're saying. So that's why you need to use as simple as possible. Okay, and final verification is also very important. So final verification at the end of the counseling, then normally you ask, just to make sure I didn't miss out anything, can you tell me again what we have discussed just now? Or just to make sure that I've gone through everything correctly, can you briefly tell us again what we have go through just now? Okay, so these final verifications, then you can help to pinpoint which part of information's misinterpreted by the patients. So there are several functions of health communications which you already know that we're trying to influence either at the individual level, means if you one-to-one to a patient, or to a community. Here could be a group patients, or it could be through a health communities project or public health projects. Okay, so with the there are public health scientists have warned us after COVID-19, there are several more that are coming, monkeypox, several more of these variants. So remote consultation or telemedicine or online pharmacy is here to stay, or even, for example, now online teaching is also a part of the syllabus now, including at UBD. Okay, we do blended learning, which with online learning still in place. Okay, thanks. Okay, so let's move on. Let me hide this thing. Sorry. Okay, what are the elements of successful health communications? So we're going to touch on the health literacy. Okay, if for those who are not aware what is health literacies, there are numerical literacies, knowing about numbers as simple as one tablet, half tablet. They might not be imagining what is half a tablet, not even sometimes we say quarter tablet. That is actually very hard for patients to comprehend and then to comply. Okay. So health literacy we're going to go through briefly is patients have the capacities, okay, or the skills to assess and evaluate and then to be part of the health decisions making process, which they can translate into their health decisions. Okay. Health educations, this one is is as part of the health communications to educate, to influence the public's or patients' knowledge, or especially like for example, they try to a lot of patients self-medicate either using their herbal medicines, direct selling. There are so many medications out there they can choose from. Okay, so it's very important to tell them to let you know as a healthcare professionals what they are taking so that we can help them to reduce potential drug interactions or drug herbs interactions. Okay. Social marketing, this one I'll have one sessions on the entrepreneurial marketings and also using research methods on the pharmaceutical marketing. So we're going to explore this one further. Okay, this is also very important from a pharmacy point of view. So let's so for the following 1.5 hours, there are 5 parts that we're going to cover. Okay, first part, let's go through together health literacy. What is health literacies and what is important? So just now we under the health communications, we discussed health literacy, health educations, and social marketings. Technically, health literacy is patients having the capacity of access to the informations, including the counselings that you get through face-to-face, which then balance out the risk and benefit. Okay, it will be good if their decision-making process involve healthcare professionals, okay, which can decide together with them, not just one-way communications like, okay, you take these medications, 1 tablet once a day, but they might be denial. They might not think that they have this problem. Okay, a lot of patients, when they are being informed by the healthcare professionals, like my mother's, she was a diabetic patient. She's a diabetic patient, but when she was first diagnosed, she don't want to take the oral hypoglycemic agent because she think that she would not get because her parents doesn't have diabetic. She lead a healthy lifestyles. Okay, so taking health actions here, it could be going to see doctors, coming to refill their medications, taking their medications. Okay, this is what we're trying to influence. Okay, so at the end, they feel good about themselves. Okay, either their health could be improving or deteriorating, depends on what kind of health action they are taking. Okay. So for as a healthcare professional, as a pharmacist, we need to have this health literacy competency, which means that we can use our counseling at the suitable to the patient level. Okay, you might come across a patient which is very well versed with medications, read a lot, show you a lot of papers. Then you know that you can raise the bar. Okay, use a more no, technical terms because they understand it. Or if you're talking to let's say medical doctors, obviously you will use all the medical jargons. But if it's a layman persons or normal general public that doesn't have so much of that have a low health literacy, then you have to use a suitable layman terms to communicate well, okay, so that they can help to give rise to a positive health decisions. So just now we are talking about 50% of patients not taking their medications, 80% forget what doctor says. What about health literacy? Okay. Up to 42% of the patients could not understand the directions of taking medications, okay, on an anti-stomach. Okay, because a lot of times, or take it before meal. This is very vague. Half an hour before meal, immediately before meal. Okay, so but even if you tell them, if the patients on multiple medications, polypharmacy, let's say 5 medication above, okay, that's why a pill box come in handy, or now they have this patient pack with proper instructions printed. Obviously, in terms of resources, it's consume more resources, but overall, it can help to improve patient medications adherence that can help to reduce readmissions to the hospitals. Okay. So I have some little exercise here, which later I show in the next slides. Okay. So just to help you to imagine when you look at those numbers or those printed words, if patient have a limited health literacy, they will not be able to understand it. Okay. So if you can read, if should read from backward, like cleaning to assure, high. So this is technically, if you can spend 1 minute trying to read out on your own. It's quite difficult, isn't it? So that's why we always need to put ourselves in the patient's shoes, that whether can they understand. Okay. So please, I give you 3 minutes to go through this case, which are going to show you a video on the counseling done by my students. So this one can be a remote consultations also, because the medication can be sent or can be dispatched to the patients by post. So imagine now you are the pharmacist and then you have to counsel the patients. Let's go through the video together. Let's start with Umu. Let's just take 1 minute to go through the case.
If I ask a few questions regarding your daughter's medical condition?
Yes. May I just check with you? My daughter have been just prescribed with this syrup, which I've shown you on as if this is a syrup. Huh? I'm not very clear with the instructions given. Can you please tell me how to use or how I can give this syrup to my daughter correctly?
Okay. Is it all right with you if I ask a few questions regarding your daughter's medical condition?
Yes.
Okay. Before I start, I would like to ensure you that everything discussed will be kept private and confidential. May I know your daughter's name, age, and BN number?
Amanda Lim, 3 years old. BN number is 7891011112.
Okay. Do you know for what this medication has been given to her?
You mean what the doctor told me about this medication for, is it?
Yeah.
The doctor said that this medicine is good to stop my daughter's vomiting.
Okay.
Yeah.
Has the doctor told you on how to take this medication, or he didn't?
He briefly mentions, but I was very worried that time. I didn't get what the doctor said.
Okay. May I know how long he's experiencing this?
For 1 week now.
Does she have any other medical conditions?
No.
Okay. Is she taking any medications, either prescribed or over the counter, such as herbal supplements or vitamins?
No.
Okay. Does she have any allergies?
So far, no.
Okay. How would you describe her diet?
I still mainly on I'm not breastfeeding, mainly on formulations.
Okay. All right. May I know her weight?
15 kg, 1.5.
Okay. So for the dose, you are required to give her 5 spoonfuls of ranitidine oral solution 2 times a day. I advise you to give this medication once in the morning at around 8 a.m. and once in the evening after dinner. And also avoid giving her spicy food and oily foods, and as well as citrus fruits such as lemons and oranges. And also, if your child vomits after 30 minutes after the medication is given, give the same dose again. But if your child gets sick more than 30 minutes after having a dose of ranitidine, do not give another dose. Wait until the next normal dose. So I'll give you the medication. Do you have any other questions?
How many ml again?
It's 5 ml spoonful 2 times a day.
5 ml spoonful.
Yeah.
What do you mean by 5 ml spoonful?
5 ml, 1 teaspoon.
Oh, you mean 1 teaspoon? Okay, 1 full teaspoon.
2 times. Yeah, 1 full 1 full teaspoons.
So it's 1 5 ml and another 1 full teaspoon.
No. It's 2 5 mLs. Because 1 teaspoon is actually equals to 5 ml. So you give 1 teaspoon 2 times a day. So yeah. Okay.
So it's a half teaspoon.
Also, I would like to ensure you that no. It's 1 teaspoon 2 times a day.
How to give 1 teaspoon 2 times a day? It means I take half in the morning and then half first dose and then another half another second dose, is it?
No, you take 1 teaspoon in the morning and another 1 teaspoon in the afternoon, in the evening.
I see. Then I got
So
you.
3 teaspoon per day.
Okay. Now
Okay.
I got you.
Okay. So I will also tell you that this medication may cause her drowsy. This is one of the side effects, but you do not have to worry about that. And
Drowsy? No, doctor
yeah,
didn't say it will cause drowsiness. Are you sure?
yeah, but it won't. It will cause her sleepy, but it won't affect that much. You do not have to worry because it's a common side effect.
Okay.
Okay. Do you have any other questions?
How long I should give this tablet for?
Take this until the doctor tells you to stop. I will give you 100 ml, which you can take for 10 days. I'll give your daughter for 10 days.
Just 10 days, is it?
Yeah, but you have to go to the doctor after 10 days to check on your condition, check on your daughter's condition.
The doctor asked me to see him after 5 days.
Okay, so I think then you should go see the doctor first. So take this medication for 5 days first, then see the doctor. If he tells you to give your daughter continue this medication, you can continue. But if he gives a different prescription or stops it, you can stop this medication.
Okay then. Thank you very much. I'm very clear. So coming back to that, it's not like I purposely. So I was standing in acting as the Amanda Lim, the patients of the Chiau. Okay, and then there was this using half 1 teaspoon twice a day. It did happen to me when I was a pharmacist, when I dispensing. So some patients really take like half, because they were saying 1 teaspoon, then that means one maximum per day is 1 teaspoon. So they take half teaspoon a day, half teaspoon. And also the use of teaspoons, spoonful is also tend to mislead or misinform the patients. That's why using syringe to measure correctly would be a better options. Okay, another thing is also sometimes patient might challenge the pharmacist saying, "Oh, just now the doctor didn't say that." So just to need to make sure your fact is right. Like for example, you don't really have to counsel patients that ranitidine can cause drowsiness because their tendency is very low. Okay, it's not it is not like, for example, after you taking the copernamines, then the side effect, the major side effect will be drowsiness that could affect their driving. Okay, so a lot of things that you can pick up from the literatures, for example, from the reference, but you need to make sure that you tell only the relevant one. Okay, if not, patients will have cause confusions for patients and lead to not taking their medications. So I imagine that you can help later on trying to detect, was the counseling just now in terms of health literacies, was it effective, and in which aspect of this counseling can be improved. Okay, let's go through why is remote consultations or virtual consultations or virtual counseling is slowly gaining traction in especially during COVID-19. Let me just hide this. Okay, so that the healthcare professionals, including doctors and pharmacists, still able to communicate with the patients, but through like now what we are doing through Zoom or through whichever software that the clinic are using. Sometimes they use Google Meet, sometimes they use, for example, WebEx. Okay, and for those for example, under home quarantine, then they were still able to talk to the doctors to help them to manage, not just for example, for the COVID-19, but for their regular medications or chronic diseases. Okay. On the other hand, if the clinicians have to serve the quarantines, isolations, then the doctor still able to work, because due to the limited human resource. Even now, for example, if the especially during the peak pandemic period in the Ministry of Health of Brunei, those are having the purple code, which means that is close contact. They still have to come to work because of the lack of human resource. Okay, increased modalities and patient choice. It means it gives them another options. Either they don't really have to travel, okay, at their home, they're still able to communicate or receive consultations from the healthcare professionals. Okay, let's go through the second part, which talking about the survey done on the future of healthcare consultations. So they have these questions, whether is it just for now or the future trend still will be using remote consultations or virtual consultations. This study was done by a Borderless Access, which is a clinical research company done in the early stage of the pandemic, completed in June 2020. Okay, so they want to find out what was the current consultation behavior of the people during the early stage of the COVID-19. Because that time in June 2020, we really don't know, we cannot foresee how long it will last, the SARS-CoV-2, because if you remember, I'm sure you are still too very young, in the early 90s, the SARS, okay, the coronavirus back in the 90s actually ended after a few months, okay, unlike the COVID-19. Okay, so the study also want to understand the future consultation behavior of the respondents. What will be their tractions towards travel consultations if they are traveling. We are talking about the travel medicines. Are they taking, like, for example, pre-departures vaccine, not just for COVID-19, but for other diseases? Okay. So the study involved 10 countries, including Indonesia. Okay. And involved around 3,000 people responded to this online survey. Okay. So these are the age group, mainly around 25 to 34 years old. So quite balanced among male and female. So these are the 4 main points of this survey. We are going to go through some of the charts with you. Okay. So more people are making use of digital consultations through phone or through virtual video call. Okay. So online consultations with video call are gaining popularities. Okay, travel related consultations slightly to grow. Okay, as I mentioned, for example, different type of vaccines Okay, they especially now the influenza. Okay, so new way of consultations. So a lot of channel have coming out to help patients to do online consultation. I'll show you a few examples later on. I'm sure it's happening across the board throughout Brunei, Malaysia, Indonesia, and other neighboring countries. So let's look at the current mode of consultations. Okay, that was during June 2020. A lot of them because of the worry that because that time it's not full, the COVID-19 vaccines is not available or just being launched. Okay, some are doing clinical trial. So due to the worry, they stop going to see doctors. Okay, even the hospitals, a lot are shutting down or delaying the appointments. Okay, so up to 35% completely stop consulting the doctors because of here means face-to-face consultations. So if you see in the Indonesia per se, so up to 28% of the respondents completely stop consulting the doctors, which on the other end, okay, 29% still go on as the normal daily, like before or like before. Okay, so this what shows that there is a potential growth in the which translated now 2020. There is a huge jump in the use of digital consulting, not just in healthcare or other other professions. So what about mode of use of consultations? Do they prefer face-to-face, online, or phone consultations? Okay, for households or families that have kids, okay, their preferred mode will still be the online consultations. Okay, whereas those without kids, okay, they continue to consult in person. 43%. Okay, which one is being most preferably used between phone and laptop or a PC? So 58% prefer using mobile phone for the communications. Okay, if which channels that will be used for the consultations? So they have these mobile apps which come with a health chat. Okay, with the healthcare professionals is the most preferred. Up to 45% are using that. Okay, another 44% through social media consultation. Like you can actually use chat during using the either Facebook or Instagram also. So what are when being asked, did video consultation influence your decisions for selecting the doctors? Okay, up to 75% say yes. Even higher in Indonesia, 86% actually say yes. Okay, so they say yes to providing consultations through video consultations. Okay, so this is more so in the Asia regions, which they have. I mean, the Asian are more getting easier to accept the fact of using video consultations. So the next sections is on the future healthcare consultation modes and preferences from the 3,000 included respondents. Okay, so here divided into the 4 different sections. Here the increase in the axis here means will use more of the digitals and here towards using more face-to-face. Okay, so if you can see this part, okay, here means use more digital and less in persons, including countries. So most of these most respondents in these countries prefer this mode, okay, including in Indonesia, Saudi, UAE, Nigeria. So for these countries, okay, including Germany, they still prefer face-to-face, okay. Whereas in UK, US, they are at the borderline of accepting both digital and in-person consultations. So is this sustainable, this trend of using online consultations? From the study, yes, because up to 43% that accepted online consultations, they still continue using it. Okay, up to here, this is almost 49% will still continue doing, accepting the online consultations with or without the pandemic influence of pandemic. So let's move on to the third part of the today's webinars, looking at the factor to consider for remote consultations. Okay, I'll take this 5 minutes short break at 8 o'clock later. Okay. So in terms of the remote consultations, there are three types of categories or three categories. First one is phone consultations, which mainly you will not be able to see just like your normal phone call. Okay. Virtual consultations, this could be with or without the video. Okay. And video consultations is with video and audio. Okay. Later, we're going to discuss also virtual consultations, even without video. It does have some advantages compared with just phone consultations. This slide shows the benefit of remote consultations divided into two categories. First, in benefit in terms of patient outcomes and benefit in terms of healthcare system outcome. Okay, so there are three listed here. First one is the improved patient experience. Obviously, especially those, for example, from Asia region, just now you can see from the studies, conducted studies, okay, they feel more secure from their home, and then they don't really have to travel to the hospitals. You know, at the hospital there might be these nosocomial infections. Okay, improve patient outcome. So study has shown that patients with done remote consultations, they're still able to comply with their medication and then continue taking their medications. Okay. Waiting list reductions, that means they don't have to wait for so long to see a doctors. Okay, because if it's the face-to-face, the waiting list is even longer. Okay. In terms of the healthcare system improvements using remote consultations, there's less people coming to the hospital, which is a good thing also. Okay, because of the needs for social distancing. Okay, expenditure savings, according to a studies that conducted in United Kingdom, up to £1 billion was saved because of not having to do the usual outpatients consultations, which can be used to procure medications. Okay, so in terms of sustainability development goal, okay, there is the less carbon footprint also. less carbon dioxide emissions because of less traveling done. Okay. But it's not all conditions can be treated via remote consultations. These are the five five aspects which remote consultation is appropriate. Okay. First one is when the patients have developed new problems and which require some assessment that doesn't require physical assessment, or the physical assessment can be done at home. Okay. When review monitoring of the patient progress. Okay. For example, if a patient is taking ACE inhibitors, there should be monitors after 3 weeks to see that if necessary to adjust the dose, or if they need to come for a blood test to see the creatinine clearance. Okay. Review of investigations and discussions to look at if patients progressing well in terms of their treatment. Okay. Long-term condition need review, especially on the chronic diseases. Okay. Or if they need the multidisciplinary team discussions, not just with one doctors, but two doctors or a few specialists, if involved imaging, looking at their chest x-ray or MRI, okay, which they need to involve their family members, which might not be staying at the same household. Okay. One minute.
So students, thank you very much for joining our guest lecture today. If you have any questions, please ask your questions into the questions box. So Dr. Ming will answer to your questions. Thank you very much, Dr. Ming.
Yeah, thanks. Sorry for the short introductions. So let's look at the factors to be considered prior to arranging a remote consultations. Let's go through the 8 factors together. Okay. So these are the triage. Triage means that you are giving priorities or trying to score the patients to see whether are they suitable for face-to-face, or would they be appropriate for online consultations. Okay. First of all, showstopper here means that they still need to be put on the normal face-to-face consultation. First of all, if patients own choice, if they don't want to have the online consultations, then they will have to do the face-to-face. Okay. And then can patient access a phone, smartphone, or is there connectivities to the internet also? If no, then obviously they have to come to hospital for the face-to-face. Okay, if there any safeguarding concern, meaning to say that if vulnerable adults or a patient at risk that will have confidentiality issues, so then they still have to come to the face-to-face for consultations. So these are the 8 factors to be considered for patients that you might be putting on remote consultations. Okay, patient choice and access to technologies. Okay, safeguarding environmental issues, emotional and mental well-being, patient consents or mental, are they able to provide a legitimate informed consent or not to do the online consultations? Is physical examinations necessary? Is patients having learning disabilities? Is patients having any sensory impairment, like for example, blindness? Okay. People living with frailties that prevented them from traveling. Okay, does it involve infant, children, and young people? Means pediatric patients. Okay, so these are the 8 factors. Let's watch a short video, and then after the short videos, then we take a short break. So in that video, try to detect if the 8 factors have been considered.
So I have your prescription. Miss Kilang, is this you?
Yes, that's me.
And this medication is for you, right? Or for someone else?
That's for me.
Okay, great. If you don't mind, is it okay to request your time, just a couple of minutes, ma'am, to discuss the key points of your medication? I just want to make sure that you know everything about your medication.
Actually, I have some errands to do today, and my kids are waiting outside. But you may just give me a flyer or pamphlet so I can just read it when I go home.
Don't worry, it only takes 3 to 5 minutes, ma'am. I just want to provide information about drugs, especially for first-timers. Is that okay if we talk about it for a few minutes?
Okay, sure. Go ahead.
So to start with, I just want to ask if you have any other medications aside from this.
Actually, none. Just the vitamins.
Oh, so, and all of those are prescribed by your doctor, right?
Yes.
So another thing, what did your doctor said regarding these medications?
Actually, sorry. That's my problem. Kindly please discuss and assist me on how will I take all these medicines because I'm a bit confused and forgot what the doctor said earlier. Anyway, I know that the medications are for my tonsillitis and for my ulcer.
So, okay, your physician prescribed you the following medication. So first is esomeprazole, 40 milligrams. This is used to treat certain stomach and esophagus problems such as acid reflux and ulcers. You will take this once a day for 1 week. So headache or abdominal pain may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Should be taken on an empty stomach and take 1 hour before meals. So next drug is this benzidamine or plus chlorhexidine 15 ml. So this is for temporary relief of painful conditions of the mouth and throat, including tonsillitis. So you will take this 3 times a day and at bedtime. So this is approximately 1 tablespoon in which should be gargled for at least 30 seconds and at 1.5 to 3 hourly intervals as needed. So it should be not swallowed, but rather should be expectorated after each use. So if any signs or symptoms appear, such as itching, skin rash, redness, swelling, breathing difficulties, lightheadedness, and rapid rate develop, monitor it or call your doctor or me for immediate action. Okay, that's it, ma'am.
So that's all I need to know.
Yes. So just to make sure you have all the information needed about your medications, is it okay to review all the informations?
Sure.
So what is this medication for?
That esomeprazole is for my ulcer and the chlorhexidine is for my tonsillitis.
Yes, and then how and when will you take these medicines?
That esomeprazole, I will take it before meal 1 hour, and I will take it 3 times, once a day. And the chlorhexidine, I will gargle it 3 times a day and at bedtime.
Okay.
Anyway, may I ask what if in case I missed or forgot to take my medication?
So great question. So if in case you forget to take your medication, you must take the next dose. Do not take 2 doses at one time. So just wait for the next dose.
Okay.
So what about the side effects?
I think I just keep an eye and monitor if there is any side effects that will happen, and I will contact you and the doctor in case of for the immediate actions.
So great, ma'am. Anyway, this list is the information and instructions that I have told you earlier for your medication so that you can remember it if in case you forget some information. And if you have any more questions, you can go back to our pharmacy or call our pharmacy in this number.
Thank you so much, ma'am. I will call you if I have any more questions, and I go back here when I need to buy and refill my medication. Thank you so much.
Thank you so much, Miss Kilang. Have a nice day.
Yeah, so hang on, sorry. Yeah, so let's take a short break now. We come back after 5 minutes. Is it okay?
Yes, thank you, Long.
Thank
I'll
you.
take over for here, and then you can take a short break. Okay,
Sure.
no worries. So I'm going to talk with the students first.
Thanks.
Okay, so with respect to the presence list adik-adik daftar hadir, so you don't need to fill out the presence list. We don't make any presence list. Just you need to, I mean, you can log into si Hebat for your apa yang namanya untuk formal saja. So for your own matters, but actually I do not require attendance list or presence list for the lecture today. So it is not compulsory to have a presence list. Everyone is already logged in our Zoom. So if you are in the Zoom now, we have your record full record of your attendance. So we don't need to make any presence list or etc. Now I also would like to highlight that this is a guest lecture delivered by Dr. Ming from the University Brunei Darussalam, Faculty of Institute of Health Sciences. So I would like to invite you also to be actively involved in this Zoom webinar setting. And then if you have any questions again, and if Dr. Ming asks questions to you, please type it or raise your hand so you can answer it. So I would like to have a very active and very engaging lecture for this morning. As you can see, Dr. Long already offered you one questions, already gave you one questions with respect to the dose calculation and also how to do counseling. So again, if Dr. Ming asks you particular questions, please raise your hands and also type it on the chat box or the question box so we can promote you as panelists and also you can answer the questions. We would like also to invite you to become panelists for this webinar, meaning that our host will invite you as panelists and you just click join and accept to become panelists, and then your webinar setting will be reviewed. So you will become panelists eventually. If you have any questions while we are breaking, please ask the questions to me now. Okay. There is one question here. Okay, and so Dr. Ming will answer to Bu Anissa Ahmad question, yeah? So Bu Anissa, we will wait for Dr. Ming to answer your questions. So again, students, this is an open case lecture. It is not only students from UNER who attend this lecture, but also students from other universities as well. So please, if you have some inquiries, be active and be involved in this lecture. Thank you. Pak Fuad, please add more panelists, Pak Fuad, if possible, so
Yes,
they can be active.
on process, on process.
Adik-adik tolong diterima ya statusnya sebagai panelis karena ini settingnya adalah Zoom webinar. Jadi kita tidak dapat, sayangnya kita tidak dapat Zoom 1000, meeting 1000, tapi dapatnya Zoom webinar. Jadi adik-adik statusnya sebagai attendee, tapi kita akan naikkan menjadi panelis. Also, please tell your college, yeah, your friends that we have guest lecture this morning. Because I'm only looking at this moment, I'm only looking at 379 students attending this webinar, while there's supposed to be more than 450 persons attending this webinar. So again, please look at your friends. If they are not coming into this webinar, please invite them.
Hello, everyone. Yeah, thanks, Dr. Andy. So let's resume our webinar. So previously, we've gone through the video, which would like you to detect what are the 8 factors that have been considered. So let's go through these 8 factors together, okay? First one is the patient choice and then access to technologies, meaning to say that if the patients first, just now as you can see, the patients must be willing to be online first, or then only we can do the remote consultations. Access to technology, at least they must have a mobile phone, but in for the assessor or for the healthcare professionals, it was stated that a proper screen with 9 inches of a screen is required to actually fully engage or see the overall picture, overall image of the patients to help them to do the proper assessments. Okay, and later we come across information like, for example, those having a hearing impaired patients, then they might be able to look at the lip readings. Okay, so make sure that the patients have a proper access also, and also to the either a laptop or phone. Subsequently, if you look at when we look at the clinical pathway of a pharmacy remote consultations, we're going to discuss this briefly again. Okay, safeguarding this one, for example, those homeless on the social welfare, which might be disadvantaged or vulnerable to do this online consultations. So in this way, then it's still best to ask them to do a face-to-face. Okay. Other environmental issues, like for example, are they under a carer that would not be able to represent them well? Okay, so they need to have the presence of their guardians. Okay, or like for example, if working or doing from home, they have to take care several people. They might not have the luxury of having half an hour, 1 hour, or one-to-one on the online. So in this way, it's best to ask them to come to hospital. Okay. Okay. It's also very important to assess the patient's emotional well-being before and at the end of consultations. If the patient is not ready, don't force them. Okay, you can reschedule the meeting, or you can do an appointment for them to meet you at your clinic. Okay, and it also has shown that the patients still have the emotional stress if they want to discuss it online, especially related to sexual health or women health, men health issues. Okay, but having said that, some study have shown that men health and women health issues are more comfortable discussed online. So it depends on what kind of studies or different school of thought about this one. Okay, whether to do face to face or to do not to do face to face related to sexual health issues. Okay, but mental health, definitely yes. If the patients have severe mental health illness, a lot of time they need to do blood tests also, either therapeutic drug monitoring or other screening. So they still have to come to the hospitals. Consent and mental capacities, this is also sometimes overlooked in Asia settings, whether patients give the consent to be in the video or discussing video on the video consultations. So during the appointment, there is a one cross also when they accept to have this a video consultations. If yes, then you don't have to really ask for another consent. Okay, but if they have issues in terms of mental health, or having a less mental capacity to give a consent, then it is best not to do the remote consultations. Okay, this is also a physical examinations or looking at the factor 4, physical examination that can be overcome also. Okay, but if the patients or if the doctor need to do palpitation or auscultations, then obviously they still have to physically present at the clinic itself. But if, for example, a chronic disease monitoring, asthma, they can give in a prick flow meter at home. Inhaler techniques still can be securely assessed online. COPD, looking at their improvement of the symptoms. They are using both the controller or preventer correctly. Okay, assessing different inhaler techniques. If they are using the dry powder type. For diabetes, they a lot of times self-monitoring of blood glucose at home also can be routinely done. Sometimes the either they can team up with the community pharmacy also. Okay, now also they have this 24 hours monitoring meters, which is a stripless. They just put the device underneath the skins, and then it will have a continuous monitoring that can synchronize with the mobile phone, which the data can be accessed by the doctors or pharmacists. Okay. Liver disease, looking at the healthcare review plans for those chronic diseases or pre-diabetic patients, trying to prevent them having a non-diabetic hypoglycemics. If a lot of times, sometimes patients do self-medicate also, which help to consult them about the use of their self-medicating drugs or self-medicating agent. So still on the factor 4 prescribing, this is also very important. Online prescribing also have been used. Even, for example, for pharmacy, you also can do online prescribing for those that you can pharmacy medications. Okay. Having said that, in my following webinar also we're talking about the registration, which we will touch on also what are the prescribed medications that need prescriptions, or we have also have a pharmacist medication which can dispense without prescriptions. Okay, so have to consider, do we have to doctors have to review or prescribe medications that require face-to-face consultations, for example, if they are on the IV injections. Okay, this one just now we mentioned also, inhaler techniques can be safely monitor or safely assessed online. Okay, blood tests, is it necessary? If they can also do, for example, a one-stop center, they go to the nearest health clinic, rather than to the tertiary hospital or referral hospitals. Okay, secondary hospitals that they can, smaller hospital closest to their areas. Okay. And pharmacists, then we were in charge of the medication supply following the virtual outpatient clinic, which then we verify the informations and make sure that patients can reach at home. And then once a medication reaches at home, then you can do online consultation also to see whether patients receiving the correct medication and then taking the medication correctly. So sometimes also there will be, for example, a wrong delivery, or for example, the medication might get spoiled during delivery. So you can verify all these informations through a post-delivery consultation by a pharmacist. Factor 5, learning disability and patients with autism, okay, which exclude them from doing online consultations. Factor 6, those having a hearing problem or a visual impairment, but very important, not not on the pretext that they're having a hearing or visual impairment, then you exclude them, because there's this saying from a patients with blindness. Sorry, this one is blindness. Okay, my impairment is my deaf blindness, but my disability is what other people make of it. Meaning to say that they are still very into in all these digital technologies, so don't exclude them on the assumption that they may not be able to have access to it. Okay, always check with them first if they are well equipped with all this technology. If yes, then still can be done. Okay, if they're having another caretaker, for example. So there are also some benefits of remote consultations, which is, for example, patient with frailty, or especially for those under aged care, because then you get to see the whole home environment also. Okay, to help them to, it's some kind like a home medication review for them. Okay, then you can incorporate the environmental factors to see where they keep their medications, if there's the stability issues of the medication, if it's not stored properly. Okay, can be addressed as well. So this one, number 8, is quite straightforward. If infant or children, especially baby that need to assess the neural developments, also need to be checked by the pediatricians, then obviously it is best to be conducted at the clinic or hospitals. So if you can recall back those F factors, then they consider you are very attentive participants. No? Okay, see how much you can recall. Is it just 50%, 80%? Okay. So a lot of different websites and portals throughout the world offering online pharmacy, online consultations, which can be downloaded either through mobile apps or can be done through a web page. So just fill in all these informations, then you will be able to chat or do a video call, which they also will charge the consultations. Okay, and then once a consultation completed, then they will prescribe medications, either the doctors, or then the medication then will be dispatched to the patient's home. Okay. So last 2 sections, we still have around 40 minutes, which will go through the clinical pathway of pharmacy remote consultations. And then lastly, some tips on the improving communication with the patients. So as I mentioned, with the increased use of technology and supported by the current environmental factors, so remote video consultations is increasing. So the pharmacists must be getting ready to make sure that the online consultation is effective and person-centered. Person-centered here means that you individualize, not just too generic, talking about the same thing over and over again to the same patients. Okay. How to individualize? That means you have to study their case report before, case history, and try to engage them in your consultations. Okay. So in the different part of the world, for example, in Wales, UK, they also use mobile apps to run the online pharmacy under the National Health Services, NHS. Okay. Are we still using mainly the phone consultations or with video? Okay, obviously if you video, then it take a little bit more time to set up, to make sure it is running, and also they have this you have to put the options whether to share screen, not to share screen. Okay, whether you want to have this filter for your background, So this thing with passage of time, when you're getting used to it, I think everyone is very accustomed to this now. Okay, what's the advantages if it's virtual consultations or compared with phone? Okay, if it's virtual consultation, even though with the video, without video or video disabled, you still able to share the link, share the document, share the link here. For example, for health educations, you want to provide some website for them to read. This is quite common in the Western culture. Like for example, when I was a student at UK, literally the doctor will Google in front of you, say, okay, you should look at this website. This website are good. Okay, try to read this on your own. Okay, so this is quite commonly done. So don't be surprised for patient empowerment. Okay, and if they have this translation functionality, so if let's say for example, the patient speaking different languages, so it can be translated real time. Okay, and also with the online system, which they have a proper software in place, the appointment can be generated automatically and will be sent to the patient's phone to remind them about what are the consultations, when is the next consultations. Okay, I guess it is quite common now, which you log in into the different Ministry of Health website, the health portal, you will be able to access your health record, okay, and including your medication record, okay, which is quite useful. And with the integration of system, the patients, the doctors can we can prevent over prescribing or polypharmacy, because from the system you were able to see what medication have been prescribed in other health clinic. Okay, so let's go through the SOP or standard operating process or standard operating procedures of pharmacy remote consultations. Okay, first the pharmacist will make appointment with the patients, and then will later decide whether online consultation is required. If not, then the patient will come to do the face-to-face. If they are going for the online or remote consultation services, then the appointment will be given and the patient will given a link to join the online consultations. Okay, so the patient also alternatively will be directed to the pharmacy website, okay, which they later on they will be able to log in to their system. Okay, so on the other hand, then the pharmacy team then will be logged in into the same system also, and then will be able to accept the patient in to the private online virtual chat room. Okay, so they have this waiting area, depends on the in the Zoom also they have the same functions. This technically is quite similar when you set up your Zoom, okay, or any, like for example, Webex. Okay, and then the real consultation, online consultation, will be taking place, okay, either with the video disabled or enabled, and then the record will be made. And often if the recording of the video is will be, if the video will be recorded, then they will get the consent from the patients also, and then the pharmacist then will do the proper documentations of the what the counselings have taken place. Okay, then if further arrangements, like for example further appointment, medicine supply will be then issued. So if it's possible, then just take 1 minute of your time to recall back the standard operating procedure just now, right from the making appointments to issue of appointments or the next appointment and the medication supply. Okay, I presume you have done that. Okay, you can do it later on your own. I will be sharing the slides with you as soon as we complete this webinar. Okay. So what about the setting up the system, the virtual online system for counseling? Okay, this could be done through the different software being used by your hospitals. Okay. So there are a few steps involved. First, make a plan first. For example, what kind of services that being provided? Is it a new medication counseling, or is it patients already receive the medication? You want to make sure that the patients know how to take it, or is it smoking cessations, difference, or is it a home medication review? Okay. Always it should have a standard operating procedure in place so that the patients can follow and also the practitioner will be able to follow that. Okay. And then decide the software that can be used is already in place, whatever hospital have provided. Make sure it is properly updated, the system. Okay. Share the plan with your staff so that all the staff would know. Okay. Able to conduct the remote consultations without distractions. This one we will discuss it later. Put on, make sure that there is no interruptions in between. Okay. Okay, this part is quite important. Okay. So if the patient consent to have these online consultations, then the physicians have to make sure that they are ready also in terms of what to plan for the patients depending on the patient conditions, and then anticipated examinations. Make sure that they already have know what the patient should do in order to get those. For example, if they want to measure the PEFR, peak flow, make sure that the peak flow meter have been delivered prior to or given to the patients prior to the sessions. Okay. Setting up technology and communication, this one I have explained just now. So this is quite similar. Make sure that the proper software installed and updated to make sure that there is no problem in terms of the audio and visual. Okay, sometimes just now I mentioned there is this in the digital appointment system where the patient will receive the SMS from the clinic itself to inform them or when will be their appointment, okay, how they can log in. Okay, make sure that there is a proper link for them to respond to. If there is no, then make sure there is a number which they can refer to for further inquiry. Like this is example, the automated reminders. Okay, for please be attending on which date for vaccinations at which locations. Okay, which appointment for, like, for example, ultrasound, which date, what time, at where, which hospital, which department. For further inquiry, then they can contact this number. Okay, which department. Okay, so this will be helpful for the patients if in case they would like to reschedule the appointment. Okay. Setting up the workflow also very important. The workflow in the sense of having a SOP, like for example, for schedule and unscheduled appointment or change of appointment. Okay, this will be easy for the other staff to follow and then to follow up. Okay. there should be a contingency plan, like for example, if internet fail or patient's line is cut, okay, or sometimes there's a lot of background noise will not be audible, okay, so that you can reschedule another meeting, okay. So privacy should be properly ensured. If you want to record the video, always get the consent and then tell the patients what the recording will be used for, okay. And then make sure that only authorized person have the access to patient data for confidentiality issues, okay. So when you are conducting your online consultation, make sure that you put on a sign at your door, which is quite a good thing, because make sure it's properly written, like for example, not disturb meeting in progress from what time to what time, okay, so that you will not be interrupted during your, especially your phone also, make sure it's silenced, or make sure your phone doesn't ring in between. It's a sign of in respect, if it's your phone keep ringing, or they are having these WhatsApp messages keep coming in throughout the meeting. Okay, training is very important. Testing and practice, make sure that all this information are ready in place, or if make sure that the system is updated. Normally a trial run will be necessary. Next one is the evaluations, making sure that the patients have can provide necessary feedback. Okay, the feedback either will be sent to the patients through mail, or now mostly done online, which after the interview or after the counseling, then they receive a link which they can grade the performance or how happy they are with the session just now. Okay, engaging with the patient is also very important. Okay, how they can communicate with their choice. There are a lot of other tips which are not discussed, which I will provide these extra reading materials. So make sure that you read up all those material later on. Next time when you plan to run your own online consultations. Okay, then the rest is go live, and for newbies or for the younger pharmacists, if necessary, if you can trial run with your fellow colleagues, also will be a good idea. So that was the next one, how to conduct a remote consultations. Okay, this is just to recap what we have gone through just now. Okay, specifically before the consultation, make sure that the appointment slot is given. If necessary, ask the patient to invite their family member or friends if they are the guardian or caretaker, or which can help them to communicate well if the language barrier is there. Okay, the link for the appointment should be sent prior to the meeting. Normally a reminder should be sent as well. Okay, it's good to have the patient's phone number and email address so that you can contact the patients if patient doesn't log in on time. Okay, make sure that you have a full access to the clinical system, meaning the patient medical record, so that you will be able to understand or individualize the counseling accordingly. Okay, so during the virtual consultations, just to make sure that patient have entered and that is the right patients, you can verify the information by asking their name, and then normally two verifications needed, their name and also their ID or their date of birth. Okay, sometimes the use of QR code also depends. Not all people know how to use or access the link using a QR code, because you have to open up another another mobile, or sometimes your camera icon will be able to, or camera device will be able to detect the QR code automatically now for some phone. So this is very important. Starting the consultations, make sure that, like, for example, in the beginning, or can you hear me okay? Can you see me okay? Just to make sure that they're already able to view your screen, or able to see you or hear you properly. Okay. As I mentioned, during the appointment making system, they already imply that they are giving their consultations for this virtual or remote consultations. Okay. If you look at the flow of the online consultation, this is very similar to your face-to-face consultations, but will sometimes tend to be done more formally because we are not in the hospital setting. Because if you walk into the clinic, they know that, okay, the one sitting there with a white coat will be the doctors. So this is somewhat different. If someone appearing in front of you, they might not know what is their identity. So it's best for the staff to briefly introduce themselves and then walk them through how the system works. Okay. And also verifications of the patients, ask where they are, and then are they comfortable talking now? What are their current state of mind? Are they having something rushing, or are they cooking at the same time? If yes, then they have to switch off the gas stove, everything. Okay. Look at the patient's facial expression also. Do they look upset? Are they keep watching look at the non-verbal communication? If they keep watching on the clock or look at their phone, okay, they might be not focusing at that moment. Okay. There are some flags or some indicators that they might not be able to devote that specific time at the moment, that time. Like, for example, if their phone keep ringing. Okay. So make sure that the safeguarding protocol is in place. For example, if they are vulnerable or kids, okay, make sure they are being accompanied by a caretakers. Okay. If it's online consultations with video mode on, okay, it might not be necessary to look at the camera, just to make sure that looking at the screen is fine. Okay. Okay. And make sure that you able to see the patient face clearly. Okay. If no, then you have to might ask the patient to adjust their camera. Depends on their design. Like, for example, for this laptop of mine, the camera is at the keyboard rather than at the screen. So the way you see my angle is rather unusual. Okay. Make sure that you, when you are on the video, okay, make sure that you are ready and dressed properly. Okay. Because to give that the good impressions to the patients as well. And if note taking is necessary, okay, do make sure that you are not showing too much, you are typing or working in other area or at the same time, because it was rather distracting for the patients if they don't have the eye-to-eye contact with you. Okay. Make sure that you know how to engage with the patients, and if necessary, taking notes. So you can tell them in advance, the patients, or while doing the online consultation, you will be taking notes also. Hope they don't mind. Okay. So inform them in advance. So closing the consultations. Okay. This one is also crucial to do a few correct steps so that leave good impressions for the patients, so that they will be happy to come for the next sessions with you. Okay. it is very important to summarize the key point, just like for example just now, the final verification. Okay, if you see from the video, to make sure that the information is on the same page. Okay, especially sometimes the line is cut in between. Okay, so make sure that all these key points that you have addressed, you reconvey to the patients. Okay, and then ask the question, ask patient to ask if they have any questions or anything need further clarifications. If no, then provide them the contact which they can have, either the hospital extension or pharmacy extension number or general email address. Okay, as a rule of thumb, normally you don't give your personal mobile phone or personal email, because the patient thought that then you are giving consent for them to contact you, so they might really call you, which is then unrecorded in the system. Okay, so if after the consultations, if necessary, then you post the medications to the patients and make sure the medication is well received and then properly used by the patients. Okay, and if necessary, then they can come to the pharmacy for a in-person examination or in-person counseling sessions. So this is a summary of the virtual consultations infographic prepared by the UK National Health Services, NHS, how to schedule, how to prepare, how to consult, following what we have gone through just now. So let's look at the part 5, the last part on the tips or techniques for improving communications. So our last 15 minutes of our today webinar. Okay, this is especially important if you can detect if the patient have limited health literacy. How to know patient have limited health literacy? These are the indicator, or we call it the red flags. Okay, patient fill in the registration form incorrectly or incomplete, or frequently miss the appointment or come in late. Okay, not able to follow the medication direction or procedure. That means not fully comply to the medications without any obvious reasons, or not refilling medication on time. After your counseling, during the final verification, they're not able to relate how to take their medication correctly. Okay, when they only come in when the illness getting severe or advanced stage. Okay, you know that is the all the telltale sign that they are not able to understand well the health medication information given to them. Okay, because in the now internet or IT era, most of the information patient can access through online portal search or just Google. They're able to find a lot of informations, even on the how to diagnose which patients with good health literacy, they will do it in their first place. And if they find there's some irregularities or irregular things happen to their body, then they will quickly see a doctor, but not for those who have a limited health literacies. So if you know patient have a limited health literacy, make sure you give more time to them. Okay, you can explain more, talk slowly. Okay, ask at the appropriate time if it necessary to repeat. Okay, to make sure that they have the a proper time and to understand what you are trying to convey. Okay, use of plain non-jargon terms also very important. Like for example, don't use analgesic, use a painkiller or medications for your pain. Okay, carcinoma obviously is too medical jargon. Cancer, or lesion or wound. There are a few. I will share with you also a non-medical jargon booklet which are very useful that I keep reading, also trying to improve each time during communication with the patients. This is, for example, rather very useful also. Like for example, when you say, "Oh, this is a chronic conditions," this is or don't say disease, condition. Your condition might persist, so but you can overcome it. So make sure you come for a usual follow-up. Okay. Rather than saying "don't worry," okay, put more positive tone. Everything will be fine as long as you follow our instructions. Okay. You're going to have this. You're going to have to live with this. This is rather cruel to say that. Okay. So put in a more constructive way. You may need to make some adjustment to your daily life. Okay. So to improve the overall mobilities. Okay, especially those who have a knee problem. Okay. So plain languages is very important so that and you have to practice it. Sometimes if you detected that or I saying some jargon, then you rephrase it. Okay. And also the reading material should be able to be understood by the patient, so there's a good readability lah. And also the font size should be big enough for those having visual impairment, those having glaucoma or having macular degenerations. Their visual is somehow affected. Okay, clear illustrations also quite proper. I'll give you some example. So this is very wordy, isn't it? Okay, but if you put it in the image diagram infographic with some descriptions, will be easier for patient to understand. Okay, this is another example. From 4 lines, then you can cut down to 2 lines. Okay, and increase the compliance as well. This is for the traffic police. Okay, to avoid penalties as well as further interest, you must pay this bill by its due date. Yeah. Okay. So these are some of the web page which have a very good icon which they click on, easy to read using a plain language. Okay, protect yourself from HIV and other STD, get nutritions, all in the positive action verb. Okay, rather than using a passive like have to be or will be given. So very briefly about cultural bias. Cultural bias is everywhere because we may have come from different backgrounds, and it's also very important to accustom or to adjust your counseling to suit them so that patients, you are able to touch patient hotspot to patient understand that or will have the feeling that this pharmacist really care about me. So we belong to the same group. There will then the trust is there, will be able to enhance or translate into a proper counseling. Okay. So these are some of the non-verbal communications that you should you should know, especially when you are talking, especially during online consultation, they can see your face full on. Okay. Also, for example, there are some hand gesture, like for example, in Arabic word, this thumb up is considered rather obscene or offensive. Try not to use it lah. For example, if you're talking to a Saudi patient from the Middle Eastern country, don't show this. This one is not a very good sign. There are some different one as well. For example, finger cross in Western world is quite, it's a positive thing. Say okay, keep it finger cross means that keep it positive. But this is rather offensive for in Vietnam culture. These signs, like for example, so this is rather rude for example, in those from the Philippine cultures. This one is also very interesting. I see it quite often. Okay, normally this V sign, isn't it? But if you turn it around, this is not a good sign. This is considered as the pointing a middle finger in the US. Okay, especially if you are talking to audience from UK, Australia. Okay, so don't show this sign. This is not a good thing. Okay, this one also not a good sign for in the Brazilian or those Portuguese speaking country. So make sure that when you want to show a proper hand gesture, understand their culture as well. Okay, so understanding the cultural aspect also very important as part of your communication, especially if some certain regions that have a strong belief and either religious with a religious tone or supernatural tone or their personal belief. For example, in certain part of the like Malaysia, Brunei also, they have this spiritual healing, not just bomo. So if a patient asks you, pharmacist, may I know what do you think about spiritual healing or going to see bomo? Normally, what you will answer, okay? So if patient pop these kind of questions, that means they either they have tried or they're going to try, but they already have their preconceived decisions that they will still go for it. They just want to hear from you. So it's not up to you to influence their decisions, but it is your role or responsibility to provide evidence-based information. So rather than straight away talk full on, telling them, oh no, this is not evidence-based, I have not shown in a clinical trial, ask them first, okay, fill in the gap. Like I will, like when I was a younger pharmacist, I tend to fall in the trap. Then I keep on talking more than patients. Actually, the patient should talk more than you. So keep on asking them, or any particular reason for asking this, or you can then use a third persons to relate it. Or I have this patient A have previously asked me the question also, or may I know what is your personal reason to ask? Okay, ask them to tell you, okay, why they want to see. Is it from influence of family members or influence of the neighbors? Okay, after hearing their stories, then you will have a more information to guide them or to lead them to the correct information. This is also very important for cancer care. A lot of times there's a lot of scammer. They have unscrupulous, they have no ethics at all. What they want is just a patient money, so they will guarantee the patient that the cancer will be cured. And this is very cause a very detrimental effect on their recovery, because they delay their time for chemotherapy or radiotherapy, and by the times they already reach the stage 4. So it is best to prevent them being misguided to go for all this wrong spiritual healing. That is especially for those critical diseases like cancer. They should come to get the treatment from the hospital as soon as possible. So rather than telling them all this straight away, ask them first what is the main reason for them to ask that questions. So from there, you will be able to have a proper counseling, and also the patient will appreciate more because they know that you really care about them. So these are the 2 further readings that we will share with you later on. First one is the full descriptions on how pharmacists can operate or can implement online a pharmacy or online consultations. This is a list which I find it really useful of plain language, the non-jargon way of communicating with patients. Yep, I think, yep, I have come to the end of my today webinars. I'm happy to take any questions or comments.
Thank you very much, Dr. Long. That's very inspiring and very interesting presentations. Sorry, I'm on my faculty trip now at the bus. So anyone, please, if you have any questions, just raise questions either through chat box and also for just raising your hand so we can give you an access to ask the questions tadi. Silakan adik sekalian, kalau ada pertanyaan langsung saja diajukan ke Dr. Long. You can also handle questions in bahasa. I think it's okay if you have any questions in bahasa as well.
Bisa.
So there is one question. Okay. There's one question in the Q&A, Dr. Lam. What should be maintained regarding professional ethics during consultations, collaboration with the pharmacists, doctors, and patients dealing with chronic diseases in the digital era?
Yeah, thanks, Anisha. Very good questions. I agree with you. Okay, the professional ethics that I actually didn't discuss about the ethics here. Good point. So a lot of time is now it's rather like a competition, okay, for the patients between doctor and pharmacist. They're trying to keep the patient to themselves, obviously for their financial gain. The longer the patient stay with them, the more medication they can prescribe, the more consultations they can charge. This is the hard to swallow truth, but that's why it's very important to have this core ethics, that then they should have this CME to make sure that the patient, the doctors and the pharmacists as well are always being reminded. Okay, if necessary, then they should refer. Okay, like for example, even like among doctors, they have a lot of such specialties. So if necessary, then they should refer, for example, to the cardiologist, endocrinologist, okay, the GP, not just keeping the patients at their clinic, or if it's necessary, then they should ask the patients to a referral center. Same thing also during the triage, the community pharmacies. If the patients need urgent care or the patient need to be on the prescribed medications, always they should refer them. Okay, tell them that which timeline, that how urgent it is. Either they should go to emergency straight away, or they can wait the next day to make appointment with their GP or go to the nearest hospitals. Okay, but there is a lot of ethics guidelines or code of conduct or core ethics that they suppose when they sign up as a healthcare professional, they should abide to it. So make sure there's a lot, you can do a lot of studies also to identify what are the common pitfalls or non-compliance for those not compliance to the ethics. Like for example, overprescribe of the antibiotic. This is a very common issues causing this antimicrobial resistance. Yeah. Hope I answer your question well, Anisha.
I think so. Yeah. So it is correct, Dr. Lam. So with respect to ethics, there are particular situation in which we have to be in dilemmatic situation or in dilemma. For example, back in before the pandemic situation, back in about 2018 or before 2018, I still have an experience. We had experience in which we have underestimated the ability of geriatrics or elderly people in using technology for communications about the prescription, etc. We didn't have any insight or any sort of like belief that the elderly or genetic people can use technology for communication. Are you still listening to me?
Yeah.
Okay. Yeah. So what we had that before, when we want to wanted to offer an approach in digital, we kind of underestimate and we kind of disbelieve that, oh, I don't think that this is kind of particular populations that can use digital technology or they use the app, etc. So we kind of don't want to offer them that particular approach. However, during the pandemic situations, when the COVID-19 comes, when the COVID-19 came, and then uh, all of us were forced to use a distant communication and distant service, we eventually found out that the elderly and also the older population were actually also able to use a digital approach. This is kind of ethical dilemma at one point because we we actually don't want to provide them with such service, but after the COVID, after everything is already settled, after they were pushed and all the situation were forced us to make a distance services, it is found out that, oh, the elderly can handle. The elderly can also use some such kind of application and also such kind of approach, the digital technology approach, which is beyond our expectation before. So, so uh, until now, we kind of offering, so it is it's quite different situation now. We kind of offering people how with the application, with the use of distance communication rather than uh, offering them a one-on-one or in-person communication at first, because now people are the new normal of the people, they would like to have distant communication first before they coming in person. So it's a big one of big change during this pandemic situation, I think.
Yeah, I agree with you, Dr. Andy, because the choice should come from the patient itself. So don't exclude based on, for example, if they are older adult or if they're having a hearing problem. So the decision should come from the patient itself. having a road trip. Also, I just want to point out also the like for example, Dr. Andy, I read a lot of your previous work on the antipsychotic psychology on the patients of with psychology disorder, psychiatric disorder. So all these chronic diseases also should be properly dealt with also in terms of long-term medication prescribing.
Yeah, agree. Yeah, that's because when the people, the elderly or people with psychotic medication, under psychotic medication, they have a really dilemmatic situation as well. When they become compliant with the medications, they will be prevented from relapse or kambuh, yeah. But again, when they do this, when they consume their medication regularly, the problem is they will be suffering for metabolic syndrome. This is quite a what is called maju kena mundur kena, yeah. So when they use the medication regularly, they don't get any relapse. Mereka akan sembuh dari atau normal dari psychotic state. But again, when they use it regularly as well, they will have the adverse effect from the possibility of suffering from the metabolic syndrome. So this is kind of our studies that we use, and then why we do at this moment also a lot of Dr. Long, because it is quite tricky to handle people with such medications.
Yeah, good point. I fully subscribe to this. Any other questions?
Yes. Any other questions, students? This one again. Oh no. Okay. I think we have concluded all. Everything is already provided, and I believe it is clear for us. Then, as we know that Dr. Long is delivering lecture about the pharmacy's communication in the digital era, or using the digital technology and also the public communication for pharmacists. So I think today's lecture will be beneficial for the students as well to understand that we perhaps we cannot no longer provide any communication in a common or normal way, because there is also possibility to do it in a distant service and also using digital technology. So I think this lecture will be an insight for us to do that, and also it is quite important to anticipate such topic in the future or such possibility in the future. Thank you very much, Dr. Long, for your time and also your contribution in the guest lecture.
Pleasure. I hope looking forward to see everyone again.
Okay.
Take care.
Okay. Thank you.
Have a
Bye-bye.
good
Thank
trip,
you.
Andy. Thank you. Okay.
Terima kasih semuanya. Kita tutup. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih.
Terima kasih, Pak.